If you work in the Bay Area, you are likely to have Russian-speaking patients. In order to establish a positive, therapeutic relationship, it is important to understand their background and cultural foundation. Who are they? What are their beliefs and attitudes toward healthcare? The former Soviet Union encompasses the largest territory in the world and is home to over 100 distinct nationalities. Because of this, much like Americans, the people of Russia and their culture are not easily characterized. There have been 5 waves of Russian-speaking immigrants to arrive on American soil, immigrating due to economic hardship, political repression, religious discrimination, or a combination of those factors. San Francisco County is home to a community of 25,000 to 32,000 Russian-speaking people. Food is a big part of Russian hospitality. Russians can spend hours at the table, eating, drinking, and talking with friends. They never mix food with business, they don't have serious discussions while eating, and they never have brown bag lunches. Russians have traditionally considered having extra weight to be a sign of good health. As a matter of fact, the Russian verb, which means to get well or to recover, also means to put on weight. The Russian diet is high calorie, high fat, and high sodium. Russians eat a lot of prepared and deli meats, including dried sausage and pickled meats. Traditional ways of preparing food include frying, boiling, and baking. Vegetables, when they are served, are cooked all the way through. A typical Russian table set up for guests includes cold cuts, lard, jellied meats and fish, salty fish and caviar, pickled vegetables, salads seasoned with mayonnaise or sour cream, and finally vodka, beer, and brandy. Russians drink hot tea with and between meals, 4 to 5 cups a day. Russians may not drink enough water because they often consider tea and coffee to be their water. What are common illnesses and considerations that you must think about as a nurse for your Russian patient? The most prevalent illnesses among Russians are cancer, diabetes, high cholesterol, hypertension, depression, and alcoholism. According to the San Francisco Health Department report on Russian immigrants, many of our elderly Russian immigrants have feelings of depression and become isolated due to a lack of English language skills. Some do not seek assistance in healthcare because they are uninformed about services available or due to the stigma associated with mental health. Russians' patients are not familiar with preventative or prophylactic therapy. They seek help only when they need it and when their disease has progressed. They also have a fatalistic view of disease and tend to use alternative therapies in conjunction with their treatment. Russians have a different expectation from their physician. They expect the physician to make the decisions about their treatment. They don't question the physician's decisions, and they expect their physicians and other healthcare workers to have a serious demeanor. Smiling is a sign of weakness. The Russian healthcare system is overwhelmed and serves patients on a first-come, first-served basis. Your Russian patient may arrive without an appointment and demand to be seen the same day. Russians tend to take their medication only when they are feeling symptoms. They often do not finish the full course of medication or do not take it as prescribed. According to the San Francisco Department of Health, the former Soviet Union healthcare system commonly prescribes alternative therapies along with the more traditional accepted therapies. When these are lacking in a treatment regime, the patients believe their care is not complete. Cupping, a Russian-specific remedy known as bunky, is used to ease fever and flu symptoms. It is thought to increase blood circulation to the local area, relax muscle tissue, and release pain. Mud baths are another part of Russian treatment. It is integral to treatment for chronic illnesses such as low back pain or lung problems. Mineral water and light exercise are part of this treatment. Russians believe that cold causes illness. They keep warm with fur and socks, close all the windows, and bundle up when the temperature dips below 40 degrees Fahrenheit. Interestingly, although Russians believe cold water causes illness, they are known to swim in ice water, which they feel is good for their constitution. Eczema and warts are often treated with the herb celandine. Microwaved vodka mixed with hot pepper is used to treat coughs.
Here are some Russian phrases that may be helpful for you to establish a relationship with your Russian patient. Good morning. Доброе утро. Доброе утро. Good afternoon. Добрый день. Добрый день. How are things? Как дела? Как дела? Do you need help? Вам помочь? Вам помочь? Good night. Спокойной ночи. Спокойной ночи. Bon appetit. Приятного аппетита. Приятного аппетита. Goodbye. До свидания. До свидания.
Although this information cannot be applied categorically to every Russian patient you encounter, we hope it will provide you with some understanding when working with this population. Thank you.